to this computer. All right, so now we are going to practice these multiple choice questions together. As we have already talked about the basic concepts, the classification of drugs, and now we are going to practice these multiple choice questions together. So let's start with the first question. So the first question is, a patient taking lisinopril for hypertension reports a persistent dry cough. What is the nurse's best response? So let's do it, in a systematic way, as we have learned how we need to approach multiple choice questions and what kind of strategies we need to use in our NCLEX exam. So the first thing is we have read the question carefully, and now we are going to highlight the keywords. The first thing is the patient is taking lisinopril, and this pril is indicating what? This pril is indicating
AC
AC
inhibitor drug.
inhibitor. Good. So this medication is ACE inhibitor.
inhibitor.
So for hypertension is another keyword, reports a persistent dry cough, right? What is the
Persistent cough, dry cough.
what is the nurse's best response? So this is the question. So the persistent dry cough is, what is this? This is the side effect of what? ACE inhibitor, right?
Inhibitor.
So let's look at the options. What is the correct response? So first we need to use the elimination technique. This is a normal side effect of ACE inhibitors. What do you guys think? Is it okay? Can we keep it? I think we can keep it. So let's keep it for a while.
This is the correct.
So let's keep it for a while, and then we can see if we need to mark this one as a right, or we need to, choose another option. So the second option is you should stop the medication immediately. No. Why? For dry cough,
No,
you do not need to
we cannot
it
stop
immediately. Yeah. And
any antihypertensively
yeah,
without doctor.
exactly. You may be experiencing an allergic reaction, go to the emergency department. So dry cough indicates allergic reaction? No.
No, sir.
Dry cough is not an indication of allergic reaction, right?
This is a sign.
Yeah. And then finally, you should switch to a beta blocker instead. We cannot change the
We cannot
medications.
directly.
Yeah, we
Without
cannot
doctor
change the
orders.
medications by our own. So right answer is
A.
good.
Correct.
Well done. So the next one is, just give me one sec. Okay, the next question is, sorry. Yeah, so the next question is, a nurse is preparing to administer metoprolol. So the keyword here is metoprolol. And this lol is actually an indication
Beta blocker.
that this drug is a beta blocker, right?
Beta blocker.
The patient's vital signs are blood pressure is 110 by 70 millimeter of Hg, and heart rate is 50 beats per minute. What should the nurse do? So what should the nurse action could be? So administer the medication as prescribed. So do you think with this blood pressure?
No, sir.
And particularly heart rate. So what is heart rate? This is on lower side,
50.
right?
Bradycardia.
Bradycardia. So do you think if a patient is in bradycardia, we need to continue giving the medications? Beta blockers? No.
No, sir.
We do not
We
need
have to
to.
hold.
We do not need to. 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 We do not
Administered.
Administer the
Continue the
medication as prescribed. Okay.
yes.
Hold the medication and notify the provider.
Yes.
This can be the right answer.
Yes. Yes, sir.
You can keep it. Okay.
Hmm.
Encourage the patient to increase fluid intake.
No.
No.
No need to.
Why? Why?
Because there
Because
is
the
no
blood
No,
pressure
sir.
is okay.
that is
Yeah, the patient can, continue with the water intake, like the normal regular water intake, which is 2 liter
Hmm.
um, 2 liter per day at least, and then administer half the prescribed dose.
no.
Can we change it?
No, sir.
No,
No,
we
sir.
cannot change the dosage
After
by
what
our
we
own,
Dosage
right? So this
without
is
doctor's order.
what we need to do.
B.
So
Hold the medication and notify the provider.
exactly. So the B is right answer. Okay, let's move on. So the third is a patient is prescribed with what?
Warfarin.
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 So warfarin, which statement by the
Digoxin.
patient indicates a need for further teaching?
Further teaching.
Indicate a need for further
Further
teaching.
teaching.
Patient
अलग
need
वो कुछ कह रहा
further teaching. Which
Hmm.
statement? So what kind of statement we need to find that is not actually
Wrong
required
statement.
with warfarin? Okay. So I
Hmm.
will get my INR checked regularly.
है. Yes.
If the patient says
True.
Yes.
I should have my INR checked regularly, that's fine. There is no problem. We don't need
Hmm.
to give the patient further teaching. I should avoid
Hmm.
leafy green and foods
Yes.
like vitamin K, right? Food that are high
That's a
in
fact.
vitamin K. So this is our
That's
understanding that
yes.
warfarin is when a patient is on warfarin, we should avoid foods that are rich in vitamin
Vitamin
K.
K.
Why? Because
K.
vitamin K is the antidote of warfarin,
Hmm.
right? So if
Warfarin. Yes.
you will have a diet high in vitamin K, the warfarin is not going to work, right? So it's
Hmm.
do not need to give the teaching in this case, okay? We need to
Hmm.
eliminate this option. If I notice bruising, I should immediately stop taking my warfarin.
This is wrong statement.
So do you think if this patient says this,
Hmm.
this statement to you, a patient repeat this statement, we need to give the further teaching or not?
Yes. We need to give the further teaching
Yes, sir.
for this
Why?
because first of thing we can't stop the medications by ourselves.
Hmm?
मेडिसिन जो है वो हमने खुद से स्टॉप नहीं करनी और दूसरा जो है वो ब्रूसिंग जो हो रही है वो मॉर्फिन से ब्लीडिंग तो होती है जीआईटी ब्लीडिंग होगी नॉट अ ब्रूसिंग.
Okay, so this is actually a normal thing. A patient taking warfarin because there will be like it. This is the purpose that we want to make the blood thin. That's why we are giving warfarin, right? So we can expect that bruising can be there. A
Hmm.
light bruising you can observe with the warfarin. So we do not need to stop the medication if we
Stop
observe
medicine.
uh, bruising, because this is what we can expect and this is normal. So if a patient says that he or she will stop the medication if there is bruising, then this indicate that patient needs further teaching. So this is the
टीचिंग.
right answer.
Teaching.
And then I will use an electric razor instead of blade razor to prevent cuts.
ट्रू स्टेटमेंट.
Fine.
ट्रू
Very
स्टेटमेंट.
good.
No.
Very good. If a patient is on warfarin, we recommend that they should use electric razors rather than,
Electrical razor.
right?
बिकॉज उसमें कट लगेगा तो ब्लीडिंग होने के चांसेस हैं
हो
और ब्लीडिंग
सकती
स्टॉप
है.
नहीं होगी.
Yes, exactly. You guys are right. Wonderful. And then the next question is, I think this is going to be a little bit tricky.
Hmm.
Scenario is a 60
60.
68 years old male with hypertension and type 2 diabetes. So the patient is hypertensive, diabetic, and prescribed losartan 50 milligram
Mm.
PU. So losartan is what is losartan? Losartan is angiotensinogen blocker, receptor blocker. The ACE inhibitors are different category, and losartan is a different category. ACE inhibitor actually prevents the conversion of the enzyme, but these medications actually um, block the receptors, right? So
Mm.
during his follow-up, he reports dizziness, occasional muscle cramping. His lab results, so this is key. Lab value Lab values are
Mm.
important. Blood pressure is somewhat okay.
Normal.
Yeah, potassium
Mm.
is on,
Not okay.
High
High.
level.
Hyperkalemia.
yeah, on the higher side.
5.6 hyperkalemia.
One is also on
Mm.
higher side, and the creatinine
Higher
is
side.
also on higher side. This indicates that
Higher side.
patient's potassium and renal functions are deteriorated,
Mm.
right? So probably the patient is going in renal failure, and that's why potassium is also high. So what's the question? Which nursing actions are appropriate based on the patient's finding? Select all, that's
Findings.
why. So we need to select all that are applicable in this scenario. So do we need to hold the losartan and notify the provider?
Yes.
Yes,
Yes.
we need to do this, right? If we do
Yeah.
not hold the medication and if we will continue, this will
Mm.
worsen the condition. Okay. Then assess for symptoms of hyperkalemia. We need to assess palpitation, muscle
Yes.
weakness. Do we need
Yes.
to do that?
And muscle weakness. Yeah, yes,
Yes,
we should.
we should
Yes. Yes.
assess.
Yeah.
Okay.
Test for
We need to
hypertension.
monitor ECG and the if the patient is having cardiac monitor, we need to have an eye on that. If uh, patient is having any kind of problem with the ECG, or patient can develop any kind of arrhythmias with that much high levels of potassium. Encourage the patient to increase potassium rich diet. Will we do that?
No.
No.
No, potassium is
No.
already high. Okay, so we will not do this.
Mm.
Monitor renal functions and
Mm.
urine output.
Yes.
Will we?
Yes.
Exactly,
Yes.
we will.
Yes.
And educate the patient regarding
Yes.
Volume.
regarding
No.
what? No?
Slow change. No.
Slow change.
We will educate the patient to
Sir,
rise
we
slowly
have to educate, na?
Do you think
Yes.
we
Yes.
need to
Yeah.
We because
educate?
Fitness.
yes, sir. We have to
Yes,
educate.
exactly. We will educate.
Hypo.
Yeah,
What the term is this?
orthostatic hypotension.
Orthostatic.
Yeah,
Hypotension.
patient
It
can
can
go into orthostatic
cause.
hypotension and can
And
fall
can fall.
and have that kind of symptoms,
Mm.
because the blood pressure is on borderline, again, like 102 and 60. Okay, so these are the right responses. Then what we are going to do next? The next question is, as a nurse, a nurse is educating a patient about atorvastatin for hyperlipidemia. So statins are the drugs that help
Hyperlipidemia.
lowering
Same class. No problem.
blood
For
cholesterol,
cholesterol.
right? Which statement by the patient indicate a need for further teaching?
Mm.
I will take my medication at bedtime. So does this require further teaching?
Mm.
No.
No.
Yes.
The statement
No.
is
No.
correct. No need for
It's
further
okay.
Yes.
teaching, right? This medication
Yes.
should be taken
At bedtime.
at
Mm.
bedtime, right? I should have my
Mm.
liver enzymes checked regularly.
Yes.
Yes.
Truth statement.
Why?
Yes.
Because liver and
It
liver
will affect on liver.
statins and
Mm.
statins, right? It can cause hepatic toxicity. Okay. And then I can drink
Yes.
grapefruit juice with my medication.
Can.
Wrong. This
He
one.
can.
He can drink grapefruit
Cannot.
juice?
So this is the
Benji,
right question. Answer.
Yes.
can a
Which
patient
is the
take grapefruit juice with
Yes.
these medications?
No. This
No.
is
No,
true.
no.
Sorry,
This is the
wrong
correct.
statement.
this is
Wrong
the
statement.
correct
Yeah,
answer.
this is a wrong statement, and this indicates
Uh,
that patient
Yeah.
needs
answer.
further
Teaching.
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 Education.
Yeah,
Yes.
we have just learned about this, that grapefruit should not be
We cannot give.
given with these
Mm.
medication. Okay, so this is the right
Hmm.
response, and rest
Yes.
are the eliminations. If I
Eliminate.
experience muscle pain, I should
No
notify
need.
provider. We
No
can
need.
check like
Mm.
this can happen. Okay,
Hmm.
then the next question. Okay, the next question is, a 55 years old female with hypertension and atrial fibrillation is prescribed metoprolol. And then again, this is LOL, which is which medication is this?
Beta blocker.
Beta blocker,
This is beta
right?
blocker. Yeah.
Yeah, prolol is beta blocker, 50 milligram PO BID. During a routine checkup, she reports
Report
fatigue
fatigue.
and dizziness. Her vital signs are, you can see, blood pressure. What is blood pressure? Normal,
Drop.
Lower side.
lower side,
Hypo.
It's the lower side.
right? Hypotension, what is heart rate?
Ready?
52 drop.
Lower side.
Bradycardia.
And
Bradycardia.
respiration, you
Okay.
can say that's okay.
Okay.
Arrange the
Sir,
following.
there is some noise behind, so
I think you guys can mute yourself. Is that okay now? Yes. Okay. Arrange the following nursing actions in the correct order. Drag and drop, prioritize, nursing action kind of question here. Okay. So, which action we need to do first? Hold the metoprolol dose. Which one is gonna first?
Yes.
So the very first thing is we need to
First.
do
A.
it.
First
A.
A.
Right? Assess the patient for symptoms of
Hold.
hypotension, dizziness,
Later.
weakness, and confusion. Later, what's gonna,
Later. First
what's gonna come
notify the
second?
C.
C?
C. First.
yes. Second,
Yes,
first
notify
notify
the
the
provider.
doctor, then assess the patient's symptoms of hypotension.
Okay, remember here, this question is already in order. Okay, I just put this in order to, just give you guys a trick, and just wanted to test you if you can see the question is already in order or not. But this question is already in order. Before you notify
Eh?
physician, remember, in every situation, whether it is obstetrics, gynae, pediatrics, psychiatry, before you notify to physician, you need to have
Assess.
your assessment done. How can you inform a physician without performing assessment? What you are going to inform? Like, you will not have your data to inform the physician. So first, assessment will
Means
come
S
first.
bar we have to follow.
Oh, yes. So hold the medication, perform your assessment. Why dizziness? Why weakness? Why confusion? What are the other symptoms? What are the associated symptoms? And then notify the provider of the
The
findings,
provider.
and then recheck the blood pressure and vital
Recheck.
signs later on, and then educate the patient to monitor for signs for bradycardia at home. Right? So this was already
At
in
home. Order.
order. Got it?
Yes, sir.
Yes, sir.
Okay, so the final question here is, a 78 years old male with heart failure is taking digoxin, right? 0.125 milligram PO daily. He presents with nausea, blood vision, and yellow halos around lights, right? So
The line.
keywords: nausea, blood vision, and yellow halos, and digoxin.
Toxicity.
So what does this indicate?
Digoxin. Toxicity.
These are the symptoms of what?
Digoxin toxicity.
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 Digoxin
Right.
toxicity.
His heart rate is 48 bradycardia, and his
48
Yes.
digoxin levels are
bradycardia.
2.3. What are the normal levels?
0.5 to 2 nanogram per deciliter.
2.0.
Exactly. So which nursing interventions are appropriate? Select all that apply. So first one, hold the next dose of digoxin.
Yes.
Exactly.
Yes.
Need to hold
Yes.
it, right? Assess
Yes.
for additional signs of
Yes.
digoxin toxicity.
Yes.
Good.
Yes.
Yes.
Notify the healthcare provider
Yes.
immediately. Fine.
Yes.
Administer Digibine, digoxin antidote if ordered.
Yes.
Yes. If
Yes.
physician
Yes.
order, we need to administer it and
Yes.
administer the next dose with food to prevent
അത്
toxicity.
ജനിച്ചപ്പോഴേ ഉള്ളതാണ് അത് പിന്നെ
Are we gonna?
അപ്പനും
Hello,
അതുകൊണ്ട്
Mavish. There is some noise going on. So can you please?
So no, sir.
Please-
I'm
Are you
alone
okay?
already.
Okay.
Nobody is in my flat.
It's Pansy. Okay. Sorry, Mavish. No problem. Okay, so the last option, administer the next dose with food to prevent toxicity. Are we gonna give the next dose? No, patient is already in
No.
toxic
We will not
situation.
give
No.
He has
toxicity.
developed the digoxin toxicity, so we need to hold the dose, right? So this is how it goes. So let me just close it,
Wrong.
and I'm going to stop here.
भैया मेरा सिर्फ एक
I'm going
एलिमिनेशन
to
वाला सिर्फ एक
okay. I'm
एलिमिनेशन का
going
गलत हुआ है बस